What can I do about skin damage and volume loss from laser treatment?
There is no question that laser technology has had a significant impact on the aesthetic field. The ability to use lasers to target specific areas of the skin has made a range of lasers indispensable in my practice. Over the past several years, there has been a proliferation of cleverly named devices marketed directly to consumers, using phrases such as erase the wrinkles and no more turkey neck. These lasers are promoted as miracles only dreamed of in science fiction. It's important to understand some of the science of how lasers interact with your skin and why questions are continuously being raised about the unintended consequences of laser treatment. One such unintended consequence is the frequent reporting by people who've undergone treatment with lasers and comparable technology for the purpose of skin lifting or tightening. Although intended to non-surgically lift and tighten the skin, lasers and related thermal energy devices are being blamed for skin becoming thinner and facial fat loss described as hollowing. I'll discuss how I approach the issues which motivate people to seek these non-surgical heating devices, as well as how I help people who come to my practice with undesirable skin changes after they've had laser and thermal energy treatment. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I routinely perform both surgical and non-surgical procedures for facial aging. I also routinely perform eyelid surgery, facelifts, and facial implant surgery. Non-surgical procedures are something I do every day in my practice, such as the placement of hyaluronic acid fillers, botulinum toxin, lasers, and radiofrequency treatment, as well as regenerative medical procedures using PRP and acellular matrix for skin quality improvement, as well as the treatment of hair loss. Before discussing my therapeutic strategy for patients who come in with the depletion of collagen and facial volume loss after laser and thermal energy treatment, I think it's important to look at some assumptions about what happens to your appearance with aging, particularly in your 40s and 50s. The first is the assumption that your skin is loose and it needs to be tightened. I have found that this assumption is the biggest driver for the marketing of creams, lasers, and thermal energy devices. Although there is some degree of skin laxity consistent with age-related changes, the more significant reason for the perception of skin laxity is bone volume loss. When you understand that bone volume loss is responsible for supporting the skin, it makes complete sense that the skin appears loose with bone volume depletion. The second assumption is that new devices are better at treating the skin conditions than existing technologies. This is not true. Lasers and other technologies are tools. A highly experienced, specialty trained physician is the most qualified to develop a treatment strategy for you. No device can replace that. Much of the industry focuses on messaging claims to consumers about their device, which are reinforced by paid medical consultant endorsements. They don't allow for enough time for there to be a more organic experience from doctors without bias to share their first-hand knowledge. Through marketing, the focus is about the device, not the professional. By creating demand through name recognition of their devices, these companies have been very successful in selling or leasing devices and the associated disposables to a range of practitioners. These practitioners are often more interested in transactions than they are long-term management or the long-term consequences of their treatment. The third assumption is that the practitioner performing the laser or thermal energy device is as qualified as a specially trained doctor to perform a procedure. Although the more modern laser devices often have touch screens to reduce the risk of incorrect settings being used, the devices aren't a replacement for a proper history and physical examination by a physician. In New York State, there is no licensure for the use of lasers and thermal energy devices. The fourth assumption is that the skin can produce unlimited amounts of collagen, and that collagen stimulation can only occur by aggressive heat delivery to the skin, so the new collagen produced will lift the skin and make the skin more youthful. Let's look at what happens as a consequence of these assumptions. Consumers go to a practitioner for the latest, greatest laser or non-surgical lifting device. The practitioner, who is paying a monthly lease for this device, performs the procedure. The qualifications of this practitioner are assumed based on them wearing medical attire like a doctor. As weeks and months go by after the procedure, the patient experiences skin thinning and feels that they look worse after the treatment. The practitioner then offers a different device treatment or performs a more aggressive treatment, often applying a higher temperature for a longer period of time. Now the skin looks even worse, and the patient is distraught about their appearance. When a patient in this situation comes to see me, I evaluate their appearance with the same systematic approach I do with any facial aging examination. I look from the inside outward. This means evaluation of the bone structure followed by the soft tissue and fatty tissue layer below the skin, and then the skin itself. I frequently observe that the patient's bone structure has significant deficiencies consistent with facial aging. This means that from the outset, the decision to pursue skin heating was not addressing the most significant basis for the appearance of skin laxity. To address volume deficiency from bone loss, I perform a technique called structural volumizing, where I use the principles derived from facial implant surgery to place long-lasting hyaluronic acid fillers such as Juvederm Ultra Plus and Juvederm Voluma at the bone level. With structural volumizing of the cheekbones, jaw angle, jawline, and chin, the improvements on the facial proportions result in a more youthful appearance. This is far more effective than what they went through with the high-priced skin heating device. The benefits of structural volumizing are appreciated immediately, as opposed to waiting to see if the skin is somehow lifted without surgery after being treated with the miracle machine of the week. I do value the technology of thermal energy for fat reduction and skin tightening and use it in my practice. I use it as a tool for specific situations where I feel it is the optimal choice for what the patient needs. For example, if you have some fat that creates the appearance of a jowl and you have good skin elasticity, I perform a jowl lift procedure non-surgically with a long-pulsed 1064 YAG laser, which I own. I actually own all my lasers because I'm confident of their value for my patients for years to come, not because they're the hot device of the week. Moving outward towards the skin are the layers of the fat below the skin. There is a difference between reducing areas of fat accumulation and reducing large areas of fat under the facial skin. When you look at someone who's younger, their skin has this soft quality, part of which is from a healthy layer of what is often referred to as baby fat. By delivering excess heat deep below the skin, these practitioners are literally destroying the fat. The fat layers under the skin are important not only as a cushion, but also for their blood supply and biochemical interactions with the skin. If you look at someone who is in their 70s or older, you can appreciate how thin their skin appears, which is significantly attributed to diminished fat layers. So essentially, these devices are being used in a way where the skin aging is actually being accelerated. I help my patients who come to me with this condition using regenerative technology, such as the use of platelet-rich plasma, or PRP. PRP is a concentration of the wound-healing cells and growth factors in the plasma, which are needed when you have an injury like a cut. This treatment has a beneficial effect on the surviving fat cells and can be performed over several sessions. I also use a material called acellular or extracellular matrix, which recruits your body's stem cells for the purpose of healing. I've used this material in conjunction with PRP since 2011 for a non-surgical hair loss treatment system I developed called TrichoStem Hair Regeneration. Patients come from around the world for this treatment. Hair is a skin appendage. I've observed that the quality of hair appears to improve when the quality of the skin is improved using this technology. The objective is to maximally improve the viable remaining fatty tissue to help the skin become healthier and more vibrant. This now brings us to the skin composed of the dermis and the epidermis. The dermis is the foundation for the epidermis. It's well established that there is a loss of dermis related to aging and environmental exposures, such as excess sun or UV light. It's also well established that controlled injury can induce a repair response that can improve the integrity of the dermis. The problem occurs when the dermis is injured beyond its capacity to generate enough collagen, which results in weakening of the dermis from collagen loss. This is particularly difficult to manage. I've been told by patients who experienced thermal energy-induced collagen loss that they were subsequently recommended to undergo additional injury-based procedures with an expectation that collagen production will occur. I disagree with this strategy. Collagen is a protein and can be thought of like support cables. The cells that make collagen are called fibroblasts. After such a significant injury to the dermis, how can a practitioner be sure that there are adequate fibroblasts with the capacity to produce the amount of collagen needed? In my mind, the skin needs rehabilitation before being challenged with another injury. It's like having a muscle injury and getting rehabilitation for healing before being challenged with weight training. My strategy for rehabilitation of the dermis is to use PRP and hyaluronic acid and use a microinfusion device to deliver this combination directly to the dermis with virtually no trauma. The hyaluronic acid provides a scaffold for the collagen produced by the fibroblasts to strengthen the dermis and enhance the healing process. This has been established in studies for wound healing in conditions where bone was exposed and effectively treated with PRP and hyaluronic acid combination. As far as the epidermis and any other issues with pigmentation, I usually make a decision based on my assessment of the skin's current state. I would consider low-energy, non-ablative laser targeted for pigmentation as well as conservative epidermal therapies such as hydrofacial. It's more important than ever for people to think twice before getting caught up in the hype surrounding aesthetic technology. In my practice, I spend a lot of time with my patients educating them about the risks and benefits of aesthetic medical products and procedures which are being marketed to them. My role has become to be the primary care doctor for beauty. Many people are being harmed by trusting their appearance to businesses who are only interested in short-term high profit. Marketers don't want you as a consumer to consult with a physician who will put things into perspective for you. They'd rather entice you and direct you to practitioners who are using their products. An ounce of prevention is worth more than a pound of cure. As I stated earlier, it's important to rethink the assumptions you have about facial aging and the state of the aesthetic industry so you don't make a wrong decision. Companies and unethical practitioners are trying very hard to commoditize aesthetic procedures and shout loudly over the voice of honest and ethical doctors. The practitioner is much more important for your appearance than any product or device. I hope you found this information helpful. Thank you for your question.